Good morning. Today presentation is history taking notes for history taking stations in PACES exam or MRChem exam or any OSCE exam. It's important rules in any history taking station. Start with reading the scenario. Read the scenario carefully and make plan before entering the station. Think about what questions to ask and write your plan on a paper if possible. Under the list of causes, you have to remember also conditions of overlap specialties, any systemic causes, any psychiatric conditions, especially all other causes like rheumatological causes, autoimmune causes is frequently presented in exams. If you feel that the information given in the scenario is not sufficient to point to a particular disease, don't panic. More information will come during patient interview, during taking the exam itself. Also, if the history was not completed during the consultation, don't panic. Take structured history, set dialogue closure, present history, past history, family history, medications and allergies, and social history in a polite and competent manner to use the time effectively. Cases with multiple pathologies are common in PACES history-taking stations. Examiner will assess your ability to recognize and interact between the conditions and established one. Use open-ended questions when asking about the character of pain. So don't put the words in patient's mouth. So don't ask him specifically, is this pain stitching or is this pain is dull aching? No, ask open-ended questions. What is the character of this pain? Check that you understand each problem before going to the next one, and make note of any positive points in history provided by the patient. Don't accept the patient assumption about their symptoms. Usually 99% this patient is bluffing. It's part of the scenario. He will direct you in another direction. So a female patient coming with amenorrhea and she's afraid this might be early menopause. No, keep digging, ask for questions. This patient at the end, we discover that she has hypothyroidism. Always keep digging for causes. As I said before, and again, female with palpitation, she was found to have, during history taking, she is postpartum, might be postpartum thyroiditis, and she is drinking 3 cups of coffee per day, and she has a family history of thyroid disease in her sister. Never forget patient name. Very important interaction during the station. So never forget the patient name. Don't forget to inquire about the patient concerns. Ask about the effect of illness on certain aspect of patient's life, like his job, psychological status, sexual life, daily activity, and on family. Explain to the patient the problem, summarize the interview, and probably close the discussion. And don't forget to advise the patient for smoking cessation or alcohol cessation. Thank you so much. This was a short presentation for notes for history taking.